Paul Ryan gave a presentation at the end of last week on the Republican Obamacare replacement, and he had a pretty cringy moment that I want to share with you.
How do you protect people with pre-existing conditions? I think this is probably one of the most important issues of them all. Here is basically what happens today. Under the current system, we have costs driving up. On the current system, options are going away, as I just described. Choices are fleeting, prices are going up, and under the current system, the fatal conceit of Obamacare is that we're just going to make everybody buy our health insurance at the federal government level. Young and healthy people are going to go into the market and pay for the older, sicker people. So the young, healthy person is going to be made to buy health care, and they're going to pay for the person, who gets breast cancer in her 40s or who gets heart disease in his 50s. So take a look at this chart. The red slice here are what I would call people with pre-existing conditions, people who have real health care problems. The blue is the rest of the people in the individual market. That's the market where people don't get health insurance or their jobs, where they buy it themselves. The whole idea of Obamacare is the people on the blue side pay for the people on the red side. The people who are healthy pay for the people who are sick. It's not working, and that's why it's in a death spiral.
Yeah, he just described insurance and how it works and said that's the problem with Obamacare. What? Yeah, what happens is you got the younger, healthier people, and they end up paying for the people who are sick. That's just not right. That's how insurance functions. Because the idea is, especially when it comes to healthcare, so like let's say you had nothing wrong your entire life and then you had breast cancer. You got breast cancer and you're stage 3, so you're pretty far along. Okay, well that's going to cost a lot of money to do the treatment. Money you almost certainly don't have. So how would Paul Ryan want it? Well, his implication is pretty clear here. He's like, well, I don't want the younger people who aren't sick to pay for her. I want her to pay her own way. Okay, well, that's where you get medical bankruptcies out the wazoo. That's where you get virtually everybody at some point in their life gets sick, and many people get sick in a horrific way like that. So what, you're just going to have people not pay for a really long time, and then they all go bankrupt. That's the kind of system that you want, because it's cost prohibitive in many instances with all these different kinds of surgeries, whatever it may be, whether it's you need open heart surgery, you need bypass, you need some sort of kidney surgery, you need a transplant, you need chemo, you need this, you need that. Nobody can afford those things. Fucking over 70% of the American people live paycheck to paycheck. Half the American people make $30,000 a year or less. So, but he's saying, oh yeah, I'll let you keep your money all those years that you're not sick, and then when you are sick, go bankrupt. That's effectively what he's arguing for. No, but an insurance system is, okay, we all pay into it every step of the way, and then when something happens, nobody has to worry about it and you're covered. Doesn't matter how expensive it is, that's how it'll work out. So he doesn't even understand how basic insurance works. Like, the reason why you have car insurance is like, so if you get in an accident, well, you pay whatever your deductible may be, and then it's covered by your company, and you paid into it, and other people paid into it, and yeah, you're effectively having people who didn't get in the accident subsidize people who got in the accident. Well, again, that's just the nature of how insurance functions. So you're arguing against the whole idea of insurance, and you doesn't even realize it. That's just ridiculous, man. So, I mean, I guess what his ideal would be is just no insurance. Every man for himself. Now, the real answer, by the way, of course, I shouldn't even have to get into this, is single payer. Because what happens with single payer is you have a single insurer. That's what it means. One insurer, single payer. That's the government. The government insures everybody. And you don't have a profit margin. So with private health insurance companies, you have a profit margin. So they have to take some money off the top and make sure that they give it to their CEOs who can get a yacht and who can get a jet and who can get 3 vacation homes. And on top of that, as we learned the other day when we broke down the charts for you, about 80% of the money paid to private insurance companies ends up going to actual care. About 20% does not. It goes to overhead, it goes to paying the CEO, and all these other things. With Medicare, which is basically a single-payer system for older people in the U.S., 94% of the money goes to actual care. Only 6% goes to overhead and all the other garbage. So what we learn with that is, oh, it's just more efficient. You get more bang for your buck. You get more health care paid for when you have a single-payer system like a Medicare system. When you have a system which is a government system, as opposed to, in the private market, it's just less efficient, and you have to skim more money off the top for the profit margin, for the CEO, for the overhead costs, so on and so forth. So the real answer is, of course, you have insurance, but you have it by the government like every other modern nation. Here in the U.S., he says, no, I don't want the government involved. I want the private companies to do it. And then, oh yeah, furthermore, I don't even want insurance, period. So I don't want to spread out the risk. I want it, a dog-eat-dog world, every man for himself, every woman for herself. When you're fine, you don't pay anything. When you're sick, you go bankrupt. That's the way it would effectively work in Paul Ryan's ideal situation.